Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about rehabilitation. We learned about physical therapy, speech therapy, and occupational therapy, as well as some of the specialty therapies, including hippotherapy. Up next, we'll talk with Cassie Thibodeaux about hand therapy. Welcome to the show, Cassie.
Good morning. How are you?
Really excited to have you here. And hand therapy is one that I have personal experience with. You helped me with tennis elbow and solved some problems for me. But talk a little bit about your background and how you wound up in hand therapy.
Okay. Well, I went a little bit of a roundabout way. So I actually went into physical therapy, that route. I was a college athlete, was swimming, had my own orthopedic injuries, and went through PT and years of that. And so, you know, PT, that's what I always heard. So that's what I thought I wanted to do. So I got into PT school, did the first year of PT school. And then I was struggling a little bit with one of my injuries, and I took a medical leave. And during that time, I worked as a PT tech. And while I was working, I met a patient that was an OT. And I'm like, here I am in PT school. I don't even know what OTs do. What's an occupational therapist? So I started looking into it. I was talking to her, and she worked with brain injuries. So I thought, and she did more of the cognitive aspect of it. So I thought I wanted to do mental health. And so here I am like, that's interesting. So let me apply, and let me see what happens. So I applied to OT school, got in, thought I was going to go into the mental health route, and did mental health for a little bit while I was in school. And I actually enjoyed it. But it just wasn't my niche, you know. And anyway, my first job was at St. Tammany. I got into the hospital and worked in inpatient rehab and did acute care for about the first year. And then the opening with hand therapy came around, and I said, and Bert, my boss, came up to me and he said, there's an opening. I think you'd be good at it. You have an orthopedic brain. And I said, I don't really know much about, well, maybe. So I looked into it, I researched it, and I went over to the clinic and I observed Trisha, the other hand therapist, and kind of saw what she did, and so that's really interesting, you know, maybe.
And hand therapy, I think, just is fascinating, and maybe that's what drew you there, because the work is so tactile. You put your hands on and do work with people's hands and arms to help them regain motor skills.
Right, and it's so intricate. It's such intricate work. And I knew I had wanted to specialize in something. I wasn't sure what at the time, but once I started getting into it and seeing what exactly it was, what types of protocols are involved with hand therapy, with certain types of injuries, and you know, just the detail of it, that was my niche. So I just kind of got into that, and I've loved it.
Well, and you can tell you love it. You got this glow when you start talking about it. And there are a lot of different reasons people might wind up in hand therapy, but talk about some of the kind of conditions that you treat.
Okay, so we see a lot of post-op injuries for the most part. I do see some injuries conservatively as well. But typically we see a lot of carpal tunnels, cubital tunnels, your tennis elbows, golfer's elbows, a lot of traumatic injuries. So we see a lot of amputations, lacerations, tendon repairs, things like that. So we do a lot of splinting, wound care, and other things involved with getting their function back in the very beginning stages after an injury with a wound. And then we'll progress them, you know, as they heal.
Sure. So there's a whole spectrum there of, you know, someone like me that had tennis elbow. It was just a matter of trying to work with me to get back to the point where I wasn't in pain and I had full range of motion and things were back to what they had been before I hurt myself. And then you got a full range of folks that may be coming to see you for a million different reasons, all the way out to someone who's maybe lost a limb or a portion of a limb, and you're having to help them develop some skills and learn forward how they're going to go about being dexterous and developing as much skill as they can with what they have to work with.
Right, and like Mike was saying earlier, with OTs, they tend to work with adaptive equipment and, you know, learning adaptive tools that they can use to function if they lose a limb or if they have to adapt a certain way. So yeah, we use different tools, like one-handed techniques, things like that, that they can do if they need to, or different little devices for their hands or orthotics that they can use to function again.
Amazing. So you're meeting with people, you work at the main therapy location by Flower Estates.
Yes.
And so you have folks come in and you work with them. You actually put your hands on their hands, and I'm envisioning some of what we did together when you were working with me.
Yeah.
But then for patients who are trying to develop skills, you probably also do some things where you're coaching them in how to do something.
Right, yeah, and they have certain goals that they want to meet. We make our own goals, but then we're talking, so the team is the therapist, the doctor, and the patient. So there's 3 of us that are involved. So, I have my own goals. I want to get your full range of motion back, but what do you want to do? What do you do for work? What do you need to get back to function, So
right. What were you doing before this happened?
Right, are you a construction worker? Do you need to be able to lift heavy things? Do you go home and garden? What types of functions are we looking at? And so we'll do some task-specific things in therapy if they have specific goals to get them back to being able to do those things again.
And I would think, particularly for people who work with their hands, you may be helping people who are really worried about what their future will be. Someone who works as a surgeon, or someone who works as a woodworker or an artist or a musician. There probably are a lot of different patient types who are trying to understand from that occupational therapy standpoint how they're going to return to doing what they did before whatever happened.
Right, and everybody's different. Everybody, depending on what the injury is or the surgery was. Some recoveries are a little bit shorter than others, some are a little bit longer than others. So, if it's someone that really, needs to get 100% back, we had a guy that worked on the water. He needed to be able to climb a ladder to get on a boat. He needed 100% strength to do that because you do not want to fall in the water. So there's certain goals that we're looking at when we're working with our patients to be able to get them back to being able to do those things no matter what their level is. But yeah, we do a variety of things. We do fabricate custom splints.
Wow.
For patients. So if the doctor orders, say we have a tendon laceration and they have to be, in so many degrees of flexion and positioned a certain way, we can make a custom splint to their hand to keep that tendon protected as they heal. So, and then we can progress them, to move away from that eventually, but as they heal, as they still have their stitches in and this and that, they have to be in that position to allow that tissue to heal in order for that tendon to get strong enough to be able to withstand the forces of our hands and the pull of our muscles.
The work we do, right.
Yeah, the work of force in our hands.
Fantastic. Well, and I know that there is a program for certified hand therapy, and that's something that you have, and I think your fellow workers at St. Tammany have. So talk a little bit about why that's important, or how that plays into practice.
Okay. Yeah, that's the Certified Hand Therapy program, and it's usually through the, the Hand Therapy Certification Commission. And you have to have 4,000 hours of direct patient care with a patient, with patients in hand therapy. And you have to work 3 years in occupational therapy in order to be eligible to apply. And then once you apply, you study, take the test, then you can add the letter CHT to your name. And that's important because a lot of doctors, especially hand surgeons, are looking for someone that they can look to that can understand the specifics that are in the intrinsic detail that's involved with some of hand therapy and someone's rehab process. So they might send an order for hand therapy and they want a CHT that can, be can well understand the protocols
Exactly.
that they need to follow, because it's very specific. It's not just you cut your hand in a tendon and you just try to move it again. You have to, keep it protected and you have to
Right.
move it passively, and then you can only move it so far, and then eventually you can move it this far, and then eventually you can grip things, and then you can, so it's a
Progression and those
progression.
goals at a time.
Yep.
That's fantastic. And that CHT behind your name suggests a level of proficiency, a number of hours, a number of cases,
Yeah.
a variety of experiences, so that those surgeons have confidence that their patients will regain what they need to regain after that surgery.
Correct. Yeah, and we have 2 certified hand therapists. So there's me and then there's
Fantastic.
Tricia Dole, and we work right next to each other, and we bounce ideas off each other all day, and it works well.
That's outstanding. Well, Cassie, thank you so much for coming in to talk to us about hand therapy.
Thank you.
You're watching Healthy Living, brought to you by St. Tammany Health System. Our topic today was rehabilitation. I hope you'll join us for a future episode of Healthy Living.